One of the more important things you learn with experience is that, the time spent with the patient is really what's important. I'm James Fenwick, and I'm an orthopedic surgeon at Penn Medicine. Like a lot of orthopedic surgeons, most of us do have a subspecialty, and my subspecialty is called adult reconstruction, which deals with hip and knee replacements, but particularly complex hip and knee replacements. When a patient comes to see us, they should expect that we're going to spend time with them, and we're going to try to understand, what their particular issue is. We often do use studies like x-rays or sometimes blood work to help get that understanding. Our goal is to make good decisions tailored to them. Sometimes that does involve surgery, but oftentimes it involves other things like physical therapy or injections. One of the really satisfying things about orthopedics is that we are focused on function and helping people restore function along with pain relief. And a lot of that does have to do with what the patient's goals are, what kind of activities they like to participate in, and trying to help them get back to those activities. One of the best things about being an orthopedic surgeon is that we do focus on function. It's very rewarding when we have a patient who can't do the things they enjoy, maybe can't even walk, and to see them 6 weeks later come in and they're like a different person. They're happy, they're excited about going and doing things. That's very rewarding.